Hey everybody, welcome back. We're going to continue our discussion of vitamin B12. Now, if you remember, this is very important, vitamin B12 played vital functions in the nervous system and the hematopoietic system, which is the blood-forming system in the body. And when you have a deficiency of vitamin B12 in the nervous system, because it's used in neurotransmitter synthesis, you can get mood imbalances, mood disorders, dementia, Alzheimer's type disease, and things like that. And in the blood-forming system, you get anemias. And whether it's a megaloblastic anemia or pernicious anemia depends on how the anemia is formed. So let's continue our discussion of this important vitamin B12. So we left off last time with this slide, and as you can see, vitamin B12 is a product of bacterial metabolism. You need the bacteria in your gut. You need the bacteria in other animals to make the vitamin B12. Now, the best food sources for vitamin B12 are animal products such as beef, liver, beef, poultry, fish, and eggs. Important sources of vitamin B12. Now, plants do not contain bioactive forms of B12 unless they are contaminated by bacteria, microorganisms, bacteria, same thing. So, important for you vegetarians out there, vegetarians commonly attempt to obtain B12 from sea vegetables such as wakame or nori, but these contain B12 analogs that are not, say that again, they are not biologically active in humans. So all of you vegetarians, you need to supplement with vitamin B12 because it is so important. Now, what else for vitamin B12? Well, it may help manage anemia, as we've seen, dementia, epilepsy, depression, as we've seen, psychosis, irritability, and ataxia. Ataxia is instability. It originates in part of the brain called the cerebellum. Psychosis and irritability have to do with nervous system excitation. And again, if your neurotransmitters are in imbalance, this can occur. You can also have a neuropathy with numbness and tingling, which is a nerve disorder. And again, vitamin B12 is important here because of its importance with the glial cells, as we mentioned in the last program. It's also helps to manage AIDS, multiple sclerosis, infertility, and believe it or not, tinnitus, which is ringing in the ears. Now, remember we said that intrinsic factor is needed. It's produced by the parietal cells of the stomach, and it is needed to facilitate the absorption of vitamin B12. Now, a lack of intrinsic factor may be the underlying reason for B12 deficiency in circumstances in which dietary intake appears adequate. So, I get a patient and they're supplementing with B12 and they're taking in enough in the diet, and yet they're still B12 deficient. That's because they probably have a lack of intrinsic factor and can't absorb that B12. Most importantly, B12 is extremely safe. It's a water-soluble vitamin. No toxicity from high doses has ever been reported. I like to start my patients on B12 twice a day in an oral form. It's an oral lozenge which dissolves in their mouth, and the body takes what it needs and it excretes the rest in the urine. Now, B12 deficiency should be considered with signs and symptoms of neurologic dysfunction, as we have said, such as peripheral neuropathy with numbness and tingling, and disorders of mood. Anemia in an individual should prompt one to look for deficiency of B12 or of intrinsic factor. And remember, if it's a deficiency of B12, the doctor's going to tell you you have a megaloblastic anemia. And if it's a deficiency of intrinsic factor, the doctor will tell you that you have a pernicious anemia. All right, and finally, if the patient is elderly and exhibiting impaired mental function, B12 insufficiency should really be considered. And again, our old friend homocysteine, if you have atherosclerosis, plaque, B12 should be investigated since it helps maintain low values of homocysteine, a cardiac risk factor. So as you can see, ladies and gentlemen, this is no joke. B12 is very, very important. So digest all of this, no pun intended, and tune in next time for a discussion of folic acid. See ya.